First, we want to look back at how the COVID-19 pandemic impacted Arkansas during the month of January. Let's start with the total number of new cases we saw last month. 67,052 infections reported between the 1st and the 31st, and that's actually about 3,000 fewer than what we saw in December. Moving on to our hospitalizations. As you can see, January was both a good and a bad month for the hospitals. While we saw record highs during the first half of January, that number's actually been on the decline in recent weeks. But despite those positive trends, Governor Asa Hutchinson continues to stress that we cannot relax on following those health guidelines. Finally, let's look at January's COVID-19 deaths. This is the sad part. The state reporting 1,184 COVID-related deaths last month. Unfortunately, that's 4 more than December, making January the deadliest month that we've seen since the pandemic began back in March. And that follows national trends. The CDC has recorded more than 90,000 deaths since the new year started, as the U.S. surpasses 26 million cases. That grim news comes as America grapples with emerging variants of the virus. So far, the variant that was first identified in the UK is now in 32 states. 3 cases of the strain identified in South Africa have been found in South Carolina and Maryland. And in Minnesota, there's been 1 case of the variant that first came detected in Brazil. On Capitol Hill, a group of Republican senators are heading down the street to meet with the president and vice president at the White House to discuss the $600 billion COVID relief counter proposal that they have put out there. Senate Republicans have pushed back on the $1.9 trillion price tag that President Biden has laid out. Key differences in the $600 billion GOP proposal include smaller direct stimulus payments, a lower income cutoff, and lower weekly unemployment insurance payments, only lasting through June.
Targeted to the needs of the American people, treating our tax dollars as if there are tax dollars, not just money to spend.
President Biden calling for $350 billion in funding for state and local governments in his COVID economic rescue plan, while Senate Republicans have no state and local funding in their proposal. Well, there have been so many heartbreaking stories of people hurt by this pandemic. A Houston man shared an emotional video online that's now been viewed all over the world. Clifton Wallace opened up about his heart issues, getting COVID, and the tough battle that he still faces. Stephanie Whitfield has the story.
Like a lot of people, Clifton Wallace's social media shows him at his best. But this weekend, the fitness enthusiast decided to be real.
Wow, I was scared. I'm scared of the uncertainty.
The 37-year-old was diagnosed with congestive heart failure a decade ago. The last few weeks have been incredibly tough.
They're talking transplants, man, LVADs, all types of things.
In his video viewed thousands of times, he was honest. He says his diet and exercise suffered during the pandemic. Then he got COVID-19.
I won't blame everything on COVID. But I do have a feeling that some things like anxiety, stress, those things did, and COVID had a lasting effect on, those with pre-existing issues.
From his hospital in Houston, Cliff told us this experience has taught him a lot.
You got to love yours. You got to love your life, no matter what you're going through. I mean, I've been dealing with this for an entire decade, and nobody knew because it was nobody's problem but my own.
But letting people in has showed the Houston man how many people care. Cliff knows he isn't alone as he faces his toughest health battle yet.
I got this.